Thank you so much, Arugda, for the kind invite and kind inclusion into this wonderful instruction course. Good morning, ladies and gentlemen. So the concept of diffractive IOLs actually originated from, if we strictly look at the history, it originated in the 18th century. In the 18th century, we had a lot of waterway transport. A lot of ships used to travel in the seas. And to show them light and to show them the existence of land, we used to have lighthouses. So how the lighthouses used to function was, there was a source of light and there were huge convex lenses all around it. The rays used to diverge from the light source and the convex lenses used to parallelize them and throw them many hundred kilometers away. That's how the lighthouses used to function. Until a gentleman called Augustin Jean Fresnel in the 18th century came up with a new concept. He said, why should we have such thick lenses? We can have a thin lens and mount one lens over the top of another. That's the concept of Fresnel prisms. So there are multiple lenses which produce the same effect. This is how the effect is produced. So multiple lenses stacked over one after the other. They also converge the divergent rays, make them parallel, and throw them onto the distance. So this is the basis of diffraction, how diffraction happens. And to understand diffraction properly, we have to go to Thomas Young's double slit experiment. When the light passes through one slit, diffraction is the course change that the light incurs when it comes across an obstruction. So this is where the obstruction is happening here, and the light starts diffracting from there. Now, if you have another two other slits in front of this light which is diffracted from the first slit, they get divided further. All right. This led to the concept that light rays actually do not travel in straight lines. The moment they hit an obstruction, they start traveling in ripples or waves. Beyond the second paired slits, what you have is many light waves. Now these light waves will obviously interact with one another. And we know that all the waves have a peak and a trough. When the peaks of two waves collide with one another, they form a constructive interference. But if the crest of one wave collides with the peak of another wave, then it produces a destructive interference. That's the reason why on the screen you have different dark zones and different light zones. The most brightest light zone is known as the zero order focus. That's where majority of the waves meet. And then progressively the first and the second order foci are built. Interspersed with them, there are the dark zones, which are obviously the result of destructive interference. So if you extrapolate that onto the IOL optics, the zero order is actually the distance focus, where maximum light is focused, the first order for intermediate, and the second order for near. So that's what the Thomas Young's double slit experiment showed us. And if you have a screen which projects the light, this is how it will come as onto the screen. To understand this interference a little better, if you look at this picture, herein the crest of one wave is not actually in sync with the crest or the peak of another wave. So the light wave that has a height is shallow or dwarf. As the waves come close, the height increases, and it's at its highest when the two waves merge together. So that is how the effect of constructive interference is built on the focal point. Now onto the diffractive IOL, the steps actually work as slits. The steps that we have work as slits. When light passes through the slits, it obviously forms a wave. Two lights passing from two adjacent slits here should have complementary design or complementary architecture for the peak of one wave to clash with the peak of another wave. And for that to happen, the two waves have to be spaced one wavelength apart, or two wavelengths apart, or three wavelengths apart. In other words, an integer of one. If they're spaced 1.5 wavelengths apart, then the crest of one wave will collide with the peak of the other wave. Okay, so they have to be integers of one. That is how a bright focus is produced on the focus side. Now, since the steps of the diffractive IOLs cannot be made opaque, it is imperative that some amount of refraction also would take place, which actually leads to the photic phenomena that all the trifocals are associated with in association with the destructive interference as well. Now, there are certain factors governing this diffraction. One is the color of light. The red light diffracts the most, while the blue spectrum of the light refracts the least. Okay? That's one factor governing it. And then the other is the slit aperture. Narrower the slit, more is the diffraction. Wider the slit, less is the refraction. So it's less when the slit size progressively widens up. Now we come to the IOLs proper, with this knowledge in the background. What are the components of interest in a trifocal IOL? One is the central bullseye. The central bullseye is the base power of the refractive lens, and it's dedicated to either distance or intermediate. We'll talk about it a little more. And the diameter of the central bullseye actually determines the focus. For example, there's a mathematical calculation which determines how much the central bullseye can be for a particular ad power. Like for example, the Restore Plus 4, which came long back, the diameter of the central bullseye should be around 0.742. Similarly, if the ad power is 3.25, which is the ad power of Panoptix, the central bullseye should be 0.823. Now there's a problem with that. If the central bullseye is less, you cannot implant it if the angle alpha is more. To counter that, what the companies did was they increased the central bullseye diameter, which should have been around 0.083 to 1.164. But it cannot happen according to mathematical calculations. So what did they do? They changed the primary focus of the lens onto intermediate. So what should have been 0.823 for the bullseye to have predominant distance focus, they changed the predominant focus to intermediate, and that's how they expanded the central bullseye diameter. That's what they did with the Panoptix. If you look at the central 1 millimeter scan coming in from a Panoptix, this is where the patient actually looks at distance, and you can see a very clear-cut myopic outcome on the tracy refraction, on the wavefront calculated refraction, just to show you. And vis-a-vis that, this is the refraction coming in from a geometric, the Vivinex geometric, where the central bullseye is dedicated for distance. As you can see, there is no myopic reading in the central 1 millimeter scan derived from the eye trace. The next factor of interest is step width. They act as slits, as we were discussing. They are always wider at the center, and as you go from the center to the periphery of the diffraction zone, the width of the slit comes down. Okay? Why it is narrower towards periphery is because there is a point where we need more diffraction, because they are standing at the periphery, so the light needs to bend more to come to the near and the intermediate focus. Then the step height, it determines the light bending to form intermediate and near focus. There was an apodization concept where the step height progressively reduced as we went from center to periphery. That was actually done to fight the photic phenomenon that was originating from the step heights, but it did not work very well because it also had a compromised near focus. It threw more light on the intermediate, so obviously the near zone. Then the diffraction zone, whether it's a full optic diffractive IOL or a partial optic diffractive IOL. So the mesopic and photopic preoperative pupillary size should be served. For example, if the photopic pupil is large, for example, then the diffraction zone should be large to cover the whole optic area, otherwise the near vision will not be good. So the full optic diffractive actually works well in these situations. Vis-a-vis that, if the mesopic pupil is small, then the diffraction zone should be small, because otherwise it will not. Okay. Now coming to the angle alpha. The angle alpha, many authorities would say that it doesn't affect the vision at all. So the angle alpha actually may or may not affect the visual acuity. You might still have a 6.6 N6, but it does affect the visual quality. I'll just give you an example. This is the point spread function of a patient who has been implanted with a Vivinex geometric, and the angle alpha is 0.315, which is well within the limits of the 0.7 millimeter central optic zone of the geometric. The PSF looks pretty good. And the encircled energy function of that particular patient. I have not changed the name of the patient for you to know that I'm talking about the same patient. The encircled energy function, as you can see, is also 99%. So the patient's energy function, the light energy that's passing through the whole IOL is pretty good, and it's pretty high in volume. Vis-a-vis that, there's another patient who has been implanted the same geometric IOL. The central bullseye is 0.7, so you should not have implanted this IOL with an angle alpha of 0.469. Look at the point strength function here. It's quite distorted. And similarly, this encircled energy function also suffers a loss. Only 74 to 92% of light energy is available to the patient for use. So this is about what we have achieved. Now, what is lying for us in the future is, we have known what diffraction does to the light. What we are working on now is, what are the component colors of the light spectrum and how to reduce the chromatic aberration, because that's one part which is not something that we have addressed to right now. So what we have understood from our discussion thus far is, the blue light refracts the most when it passes through the cornea, but the blue light diffracts the least. So it's kind of counterbalancing one another. So what one particular IOL, the Rayner trifocal, what they have done is, they have changed the orders of focus. We discussed about the orders of focus being 0, 1 and 2. What they have done is, they have changed the orders of focus to -1, 0 and 1. What they have done effectively by doing this is, the blue light which refracts the most and diffracts the least actually merge into one figure. So you do not have the components of the light spectrum forming different foci. By changing the order of focus, that is what they have achieved effectively. But how far clinically it is significant is something I'm still working on. I'm unable to, there's no equipment which can actually determine this. But this is a much better concept of counteracting the chromatic aberration than this so-called Ebbe number. The Ebbe number is actually, forgive me for using the word, it's actually a stupid concept. It does nothing to actually counter the chromatic aberration. But this is one, this echelette design is something that actually is coming up, and many trifocal designs in the future or in the pipeline are actually incorporating that. Thank you so much for the opportunity. This is where I would rest. Lot of work actually, so to understand
Anurag,
the concept of.
But echelette design is already there in Symphony lenses.
Yeah.
Right?
So Symphony also does that, but Symphony does not have the order change to -1. What Rayner claims is, by changing the order, and I was trying to understand from their patent papers, they've actually done some good work. The only thing that needs to be seen is, despite the orders being changed to -1, 0 and +1, the distant focus still stays at the 0 order focus. So that's still the brightest spot, and that's still the point where the chromatic aberrations are happening. So how far have they addressed to this is something that we still don't understand very well. But echelette in the Symphony also is working. So that's what I'm saying. The Technis Symphony, by virtue of its echelette design, actually serves the chromatic aberration more than the Ebbe number, which they actually speak that with more authority, with more pronouncement. But what works better
Ebbe
is
number is a physical phenomenon. Go through physics, Ebbe number indicates chromatic
yes, but
aberration.
on the clinical side, it does not do much to negate the chromatic aberration. That's what I'm saying, particularly on the diffraction platform.
Yeah, particularly for the diffractive IOS, Ebbe number is not important. Ebbe number is important for the monofocal lenses. Ebbe number is not important. Ebbe number is not important when there is a change of normal optics. Ebbe number is work in a spherical or aspheric IOL, especially.
True. Agreed.